In tonight's Health Watch, a surprising treatment for some kinds of debilitating migraine headaches.
Surprising because it involves closing a hole in the heart. CBS 2's Dr. Max Gomez here now to explain what all this has to do with migraines. Doctor.
That's right. You know, migraines affect about 40 million people in the U.S. They have many causes and triggers, but for about 5 or 6 million sufferers, it's thought to be related to a normal hole in the heart that usually closes up at birth. In some people, it doesn't, and sometimes that leads to this kind of headache.
It was like someone literally pounding your head with a hammer over and over all the time.
Nicole Camisso's migraines started when she was just 11 or 12 and then got much worse when she suffered a serious concussion as a cheerleader in high school.
I couldn't even read, so I was falling behind in all my schoolwork. My dorm room was always dark.
But her concussion had healed, and test after test failed to find a cause, until an unusual exam called a bubble test showed Nicole had a small hole in her heart called a patent foramen ovale, or PFO.
Everybody's born with it. It's supposed to close after birth and seal up in the first few months, but in about 20% of the population, it just never closes.
Interventional cardiologist Dr. Robert Summers says the PFO is present in the embryo to shunt blood away from the lungs in the womb when the baby isn't breathing. When it normally closes after birth, blood is routed from the veins to the lungs where waste products are filtered out. But if there's a PFO,
whatever this stuff is that's crossing through the hole is something that can change the physiology of the brain and cause these headaches.
The fix, a kind of double umbrella device that's threaded from the groin up through the hole in the heart, here represented by the hole in the plastic. Then one umbrella is open on one side of the hole and another on the other side, sealing it shut.
It completely changed my life. I would never have graduated college.
Now, Nicole was actually part of a clinical trial to show that giving patients blood thinners as a test can show which migraines are probably caused by a PFO. Dr. Summer is now launching a national trial to definitively prove that closing the hole stops the migraines. But again, it's not for all migraines. These are certain people have a small subset, but it's still 5 or 6 million people.
And a life-changing discovery for those 5 or 6 million.
And especially people who get what are called sort of these visual auras when they have their migraine. They start seeing lights and things. Those are the ones who are more likely to have that kind of a problem.
Right, that's great video showing how it works.
And then amazing how that little thing, and then it just heals over it, seals it up, done.
Pretty magical.
Thanks, Dr. Max.
All right.